Ever get that feeling? You know,
Uh,
you're suddenly expected to grasp something really complex, like you've just been handed this dense report right before a big meeting.
Yeah, I know exactly what you mean.
Well, that's kind of the situation we're tackling today. We want to give you the essential knowledge, but without all the overwhelm.
Precisely. We're doing a deep dive into fluoroquinolone antibiotics.
Right.
It's a class of drugs that many of you listening might have come across.
Right.
A listener shared some information, some sources on these drugs, and our job today is to pull out the most important stuff.
So we're talking about some pretty well-known names here, like ciprofloxacin, often known as Cipro.
Cipro, yes, and levofloxacin, or lidocaine.
Levokine, got it.
Moxifloxacin, too, that's Avelox. They're all fluoroquinolones.
Okay. And they come in different forms, right? Like pills, injections, creams even.
That's right. You can take them orally or get them via injection. And yes, some topical versions exist, but today we're really zeroing in on how they work systemically, inside the body.
Okay, systemically. So what's our mission for this deep dive then? What do you want people to take away?
Good question. We want to get a handle on how these drugs actually target bacteria. It's quite fascinating.
Okay.
Then look at the huge range of infections they're used for, but also, crucially, the really important things you need to be aware of, the drawbacks, the cautions.
Right. The caveats.
Exactly.
Yeah.
Key factors for both patients and the doctors prescribing them. Think of this as your efficient guide to understanding fluoroquinolones.
Okay, let's unpack this then. When it comes to how they actually fight infection, what's the key thing? What's the sort of aha moment?
The really fascinating part is their specific mode of action. Fluoroquinolones can actually diffuse straight into bacterial cells.
Right into the cell.
Right in. And once they're inside, they interfere with these vital DNA enzymes the bacteria absolutely have to have for growth, for reproduction.
So it's like throwing a spanner in the works of their core machinery.
That's a great way to put it. It compromises their DNA, stops them multiplying. They basically can't survive.
So a very direct hit. And I heard this unique approach gives them a leg up compared to other antibiotics. Is that right?
Precisely. Because the way they target bacteria is so distinct, you generally don't see much cross-resistance with, say, older types of antibiotics.
Oh, okay.
Which can make them incredibly valuable, especially if other treatments aren't working.
But there's a downside.
There is, and it's a really critical point. Because they are so effective, and maybe have been used quite widely, sometimes too widely, we've unfortunately seen bacteria getting wise to them, developing resistance, and developing it rapidly.
So overuse is a big problem.
It's a huge problem. This broad effectiveness, this broad brush approach, means lots of different bacteria get exposed, increasing the chances the resistance pops up. It really highlights why we need to be so careful. The stewardship of these antibiotics is key.
That makes total sense. The more you use it, the more chance life finds a way around it. So given this broad activity, what kinds of infections are we actually talking about? What's their main playing field?
Well, if you link that mechanism to the bacteria they hit, you see a really wide range. They work against lots of gram-positive and gram-negative bacteria.
Yeah, those are the big categories of bacteria, right? Based on their cell walls.
Exactly. And fluoroquinolones hit many in both groups. Think common culprits like E. coli cause a lot of UTIs.
Right, urinary tract infections?
Yeah, and P. mirabilis, K. pneumonia, also often involved in UTIs. Then you've got things like H. influenza and P. aeruginosa, which can cause respiratory infections.
Lungs, sinuses, that sort of thing.
Yes. And S. aureus, that's a big one for skin infections.
So covering a lot of the common bases, urinary, respiratory, skin, sounds like they could be a go-to for many things.
They can be effective, yes. But like we said, and we'll get into it more, there are very good reasons they aren't always the first choice anymore. And beyond those common ones, there's a more specialized use that's interesting. Certain ones can be used to prevent or even treat anthrax after exposure.
Anthrax, wow, okay. That's specific.
It is. And you mentioned the forms. Oral tablets are common, convenient. Injectable solutions for maybe more serious cases, IV options too. Ciprofloxacin and uvfloxacin, for example, you can get them as injectables, pills, and even topical solutions. But again, we're focusing on the systemic effects today.
Right. Okay, so powerful, wide-ranging. But I know there's a but. Why aren't these handed out for every little sniffle? What are the really crucial caveats? Why the need for caution?
That's a very, very important question. The answer really lies in something called boxed warnings.
Boxed warnings. Sounds serious.
It is. It's the most serious type of warning the FDA requires for a drug.
Mm.
And systemic fluoroquinolones, they carry several.
Several. Okay, like what?
These warnings highlight the potential for some really significant adverse effects. We're talking tendinitis,
Mm-hmm.
even tendon rupture.
Ruptured tendons
Yeah.
from an antibiotic.
Yes. Also, peripheral neuropathy, that's nerve damage, often in the hands or feet. Various effects on the central nervous system, too. And they can worsen muscle weakness in people who already have myasthenia gravis.
Wow. Okay, tendinitis, tendon rupture, nerve damage, CNS effects. Those are definitely not minor issues.
Not at all. And because these risks are known, the guidelines for using fluoroquinolones have really tightened up.
How so?
Well, now, they're generally not recommended for treating uncomplicated infections, things like simple bronchitis or a standard UTI,
Huh?
unless there are absolutely no other suitable antibiotic options available.
So they're basically reserved, last resort in some cases?
Pretty much. That's a critical piece of information. So if you're hearing this, you can see why it's vital to have a really good chat with your doctor if these drugs are on the table.
Absolutely. So reserved for when other drugs won't cut it. What about people who just shouldn't take them, period? Are there specific contraindications?
Yes, definitely. First off, obviously, anyone with a known allergy to any fluoroquinolone needs to avoid the whole class. Then, generally speaking, they're not recommended during pregnancy or breastfeeding. There might be very rare, specific exceptions. But for most infections in pregnancy, doctors prefer other antibiotics.
Okay. Anyone else?
We also have to be really careful with people who have kidney problems,
Yeah.
renal dysfunction. Their kidneys might not clear the drug properly, which could increase the risk of side effects.
Right, it could build up.
Exactly. And
Mhm.
similarly, they can potentially lower the seizure threshold, maybe worsen seizures. So you need caution in people with seizure disorders.
Okay.
And finally, a big one. Because of concerns about potential damage to developing cartilage and joints, systemic fluoroquinolones are generally not given to kids under 18.
Under 18, okay. That paints a much clearer picture. Effective, yes, but they definitely come with this significant weight of responsibility in how they're used.
That's a good way to put it.
So, beyond those really serious boxed warnings, what other potential side effects might someone experience? What should people be watching out for?
Yeah, it's useful to think about them in maybe two groups.
Okay.
The serious ones we've mentioned, and then the more common ones.
Okay.
So serious again. Tendinitis, tendon rupture, peripheral neuropathy, those CNS effects, heart rhythm problems, specifically something called prolonged QT interval.
Right, the heart issue.
The
Yeah.
diff diarrhea, which is a nasty intestinal infection, and liver toxicity. Those are the big hitters.
Got it. And the more common ones, maybe less severe, but still potentially bothersome.
Exactly. The more common ones often involve the central nervous system and the gut, the GI system.
Like what?
People might get headaches, dizziness, trouble sleeping, insomnia. Even feelings of depression have been reported
Okay.
on the GI side. Nausea, vomiting, diarrhea, maybe a dry mouth.
Standard antibiotic stuff, some of it?
Some of it, yes. But the CNS links are notable here. And interestingly, there can be effects on the immune system too, like bone marrow depression, which could affect blood cell counts. And one we absolutely must stress, photosensitivity.
Ah, yes, the sun sensitivity.
Big time. These drugs can make people way more sensitive to sunlight and UV light. So it's vital patients are told, avoid long periods in the sun, wear protective clothing, use sunscreen.
Good advice. I've heard stories about people getting really bad burns quickly on these.
It happens. It's definitely something to take seriously, especially in sunny weather.
Absolutely. Now, let's shift gears slightly to drug interactions. Things getting complicated when you mix medications. Why is this such a big deal with fluoroquinolones?
Well, drug interactions are critical for really two main reasons. One, they can stop the fluoroquinolone from working properly. The infection might not get treated effectively.
Okay, reduced effectiveness. What's the other reason?
The other, potentially more dangerous one, is that interactions can significantly ramp up the risk of experiencing serious side effects.
Right. So what are some examples of things that might make the fluoroquinolone less effective?
Okay, several common things can interfere with how your body absorbs the drug. Think iron salts, like in some supplements.
Iron, okay.
Sucralfate, that's used for ulcers. Multivitamins, especially those with minerals. Calcium or magnesium supplements. And antacids.
Wow, that's a lot of common stuff. Antacids, vitamins.
It is. So the usual advice, if you have to take these, is to separate them from the fluoroquinolone dose by at least 4 hours. Give the antibiotic a chance to be absorbed on its own.
4 hours, that's a practical tip. Okay, what about the other side? The interactions that could lead to more dangerous side effects.
This is where it gets really quite concerning. Taking fluoroquinolones with other drugs that also affect the heart's rhythm, specifically prolonging the QT interval.
We mentioned that QT interval earlier.
Exactly. Combining drugs that do this can dramatically increase the risk of severe, even life-threatening heart rhythm problems, like torsades de pointe.
Okay, so what kinds of drugs are we talking about here?
Examples include certain heart rhythm drugs like amiodarone or sotalol. The antibiotic erythromycin is another one. Some antidepressants like the tricyclics and certain antipsychotics like phenothiazines.
So quite a few possibilities.
Yes. Ideally, you just avoid these combinations entirely. If they absolutely must be used together, then very, very careful heart monitoring is essential. ECGs, that sort of thing.
That sounds incredibly serious. Any other major interactions to flag?
Yes, a few more important ones. Fluoroquinolones can increase the levels of theophylline in the body. That's a drug sometimes used for asthma or COPD.
How?
They affect how the body breaks down theophylline. So levels can go up, potentially causing toxicity.
Okay.
Similarly, they can increase the levels of warfarin, the blood thinner.
Warfarin, right. Coumadin.
Exactly. So if someone's taking both, their INR, that measure of blood clotting, needs to be watched like a hawk, very closely monitored.
Critical for preventing bleeding issues.
Absolutely. Then there's an increased risk of CNS stimulation, things like seizures, if you take fluoroquinolones together with NSAIDs.
NSAIDs,
Yeah.
like ibuprofen or naproxen.
Yes, those common anti-inflammatories. So particular caution is needed if the person already has a history of seizures or maybe dizziness or frequent headaches.
Good to know. One more.
One more key one, combining fluoroquinolones with corticosteroids like prednisone.
Steroids, right.
Yeah. That combination seems to significantly increase the risk of tendinitis and tendon rupture we talked about earlier.
Wow, even higher risk.
Apparently so. Patients on both need to be strongly warned. Any tendon pain, any weakness, report it immediately.
It's crystal clear that drug interactions are a huge factor here. Really underlines why you have to tell your doctor everything you're taking, supplements included.
Absolutely everything. It's crucial for safety.
Okay. Now, before someone even starts taking one of these drugs, what about testing and monitoring? How important is that?
It's vital. Absolutely vital. Especially now with antibiotic resistance being such a growing threat.
So what kind of testing?
Ideally, before starting a fluoroquinolone, a culture and sensitivity test should be done.
Culture and sensitivity. Explain that a bit.
Sure, you take a sample, urine, sputum, whatever is relevant to the infection. The lab grows, or cultures, the bacteria from it. Then they test different antibiotics against those specific bacteria to see which ones kill it. That's the sensitivity part.
Ah, so it tells you if the fluoroquinolone is actually likely to work against that specific bug?
Precisely. It's about targeted therapy. Using the right tool for the job, not just a powerful sledgehammer for everything. It helps ensure effectiveness and fights resistance.
Makes perfect sense. Use the sniper rifle, not the shotgun. What about monitoring once someone is taking the medication?
Right. From, say, a nursing perspective, or even just patient awareness, several things are key. First, assessing for any of those contraindications or cautions we discussed. Allergies, myasthenia gravis history, kidney issues.
Checking the history.
Yes. Then a good physical assessment establishes a baseline. So if side effects do pop up, they're easier to spot. Monitoring kidney function is important too, often through blood tests like BUN and creatinine. This ensures the drug's being cleared properly, and maybe the dose needs adjusting if kidney function declines.
Dose adjustments, right.
And of course, just closely watching the patient, or if you are the patient, watching yourself for any signs or symptoms of those adverse effects we've detailed, both the serious ones and the more common ones, throughout the whole treatment course.
Okay, so bringing this all together then, after this deep dive, what are the absolute key takeaways about fluoroquinolone antibiotics, the main headlines?
I'd say, to sum up, fluoroquinolones are, without a doubt, powerful, broad-spectrum antibiotics. They have this unique way of working that makes them effective against a whole host of bacterial infections.
Powerful and effective. Got it.
But, and it's a big but, they also carry a significant risk of serious side effects. Tendon issues, nerve problems, CNS effects.
The boxed warning stuff.
Exactly. Plus, they have numerous potential drug interactions. So all that means they need to be considered really, really carefully before being prescribed.
Careful consideration.
And patients taking them need close monitoring.
And as we've hammered home, the current thinking, the recommendation, is really to keep them in reserve, isn't it? For situations where other antibiotics just aren't suitable or won't work.
That's precisely the approach. It serves two purposes. protects individual patients from potential harm, and just as importantly, it helps slow down the development of more antibiotic resistance, which is, frankly, a massive public health challenge.
It really is. So, thinking about this balance then, the sheer power of these drugs versus their potential for serious risks, what does this whole story tell us about that ongoing battle with antibiotic resistance? And maybe how we need to think about treating infections in the future. It really makes you consider, doesn't it, the shared responsibility, both doctors prescribing and patients taking these medications, ensuring these valuable tools are used, well, judiciously.